Hi, this video is for hair transplant restoration surgery on a black African American man who actually flew in all the way from Michigan for me to do his surgery. And our goal today is to harvest at least 2,000, but most likely he's going to need around 2,500 or even 3,000 to very good coverage. He's thin in front all the way toward the back. But the front half is really thinning, and so we recreate the hairline for him. The hairline is really important when it comes to redefine the face and frame the face. And when you have a lower set of hairline and framing the face better, your eyes, your nose, and all the features that God create will be enhanced, and you will look much younger. But when you lose your hairline and the hairline gone up, your forehead getting bigger and bigger, and then the look will be really changed. Hair transplant, as you know, is not just determined by the surgical skill of the surgeon. The surgical skill will affect the density. The other important factor is the artistic and aesthetic details, and that's really define how natural your hairline is. And for black, and Asian, from the mid eyebrow to the hairline is around 6.5 to 7 centimeter, and for this gentleman it's around 6.5 centimeter. And then we'll go straight across. The temple is really important for black men. Why? Because it really frames the face better. Because if we have a low hairline but really wide forehead, you say, yeah, you have hair, but it still looks that not 100% natural. If you can turn this way for me, as you can see how thin how his temple has gone backward. For Caucasian men, the angle of the temple is most acute backward. For Asian men, it's less, and for black men, it's really perpendicular, and really bring the forehead forward. Again, you can see on this side as well. So bringing the temple is important. Once we get the shape down, we will transplant at a flat angle, really like 15-degree. Asian men's around 35 or 45, like Caucasian men. For black men's, mostly around really flat against skin. And then the zigzag is smaller in amplitude for black men when it's compared to Asian and Caucasian, because Asian Caucasian has bigger amplitude. So for black men, black African American men hairline is smaller zigzag. Why? It's because most black men like to line up the hairline anyway, but you have a bigger zigzag than the hairline line up because it's a lot higher. So, and then not only the precise angle is important and the zigzag, but the selection hair graft. We transplant rows and rows, single hair graft in the front, followed by root of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. I'm very excited for this gentleman because his look can completely change. We'll be harvesting by the FUE method. As you know, FUE is very difficult to work on for black African men. Why? Because not only the black curly hair is the hair is curly, but the root is curly as well. So where the hair exits, the root could lie to left, right, or any position. So my invention, the DFC method, is the most advanced FUE technique. DFC stands for Diep FUE Curve technique, and this technique predicts where the curly roots lies underneath the scalp at a very precise angle and harvest it out without damaging the root. And we'll be harvesting around 2,000, 2,500, ideally 2,500 or more, and then that way we can cover quite a bit. FUE, as you know, more popular among black men. Why? It's because most black men like to wear, the hair short as compared to Asian and other ethnic. So if you leave the hair short, well, the tiny dots of scar is scattered, so it's hard to see, and allow you to wear your hair shorter versus the linear scar. Once you have the linear scar, it's permanent for the rest of your life. You will never be able to wear your hair short again. That will really make your life difficult, and a lot of people really not doing the strip period. The strip method, it can be used too. It's for a guy with advanced hair loss and move 5,000-6,000 grafts, but the FUE is more advanced, least invasive. It is the future, and it leaves the scalp intact with just pulling one root at a time. and allow you to wear your hair shorter because the tiny dots of scar are so scattered. But it's important to find someone who not only an FUE specialist, but an FUE specialist on black curly hair. The really important question you should always ask is not if the surgeon do the surgery, but if the surgeon personally pulling the hair graft out, because only the surgeon will pull the hair graft out personally will tend to produce the best result. And always ask is, have you worked on black curly hair? And if you do, I want to see it. You want to see the most before and after, because you know, seeing photos and videos in real life, that really can tell and show that is, you know, that the surgeon actually does and actually work on black African American men, whether for men or black women. I'm very excited for this client. So 2,000, 2,500, most likely 2,500. Thank you.